as dementia residents get older, they can develop age-related conditions such as heart failure and CVAs, which can cause incapacity, and with that, bed immobility. Now, then there'll be a big change at this point, because in dementia units, dementia residents need to be independent, walking, and able to do all transfers. So if the person is now bedridden, they will now have to be transferred to the hospital, where there's a different level of care, where more medical intervention is needed. In the dementia unit, the staff ratio is 1 staff carer to 8 residents on average. In a hospital, 1 carer to 5 residents. So there's a lot more care, a lot more input, a lot more medical intervention, which is required when a person is unable to transfer and in bed most of the time. Now, it can be that they're either in bed, or as in New Zealand, what happens is the person is put into these like lazy boy chairs, where the person can lean back, recliner chairs. They can lean back, lie back as if in bed, but it's on wheels, the chair's on wheels, so they can go in and out of the lounge, watch the TV, join in the activities to a certain extent. And for dining, etc., they may have to go into a chair if they can manage it. Otherwise, they'll have to be fed in the dining area, in the lounge. So when your relative is now, say, in the hospital, say they've had a stroke or heart failure, how can you help? Well, actually, there is a lot you can do to help, especially around comfortable positioning. Comfortable positioning is so important, so underrated at times. Of course, the person has turns. If they're in bed, they'll have turns every 2-3 hours to prevent pressure areas. But the thing is, you know, in the normal course of events, you tend to turn yourself more than once every 2 to 3 hours. I mean, you like to get yourself comfortable, and often you want to change from side to side. So with your parent, say they've had a CVA and they're not communicating that well because speech is deficient, both with the CVA and of course the overlaying dementia. But still, the good way of corresponding, if that's the case, is through the yes-no answers. So yes for head nod and no head shake. You can get through so much information through this if you ask the questions. So you can say to your mother, say she's in bed, she's a bit breathless with the heart failure, you can see she's not comfortable. You just need to say, look, Mum, would you like me to position you in a way to make you a bit more comfortable? And if she agrees with that, no doubt she will, then what you need to do is bring in 2 to 3 trusty feather-filled pillows. You must have that for the comfortable positioning, at least 3, maybe 4. And in this way, I'll explain, for comfortable position, you can really, really help a lot to get a resident comfortable in their bed, to a lesser extent in the recliner chair, but we'll just go with the bed for now. Now, in hospitals, what often happens is the pillow that's given is like spongy rubber. You can't flex that. There's no positioning ability with that, and it can be very uncomfortable for the neck. There's no flex. So the pillow has to either be feather, which has got great flex, of course, or rubber chips good as well. It's also got good flex and it's stable when you're positioned, as is the feathers. So either or, 4 pillows. Okay, starting with the head. So making sure that the incline of the bed is at a level that's suitable for your mother. Say mother, could be your father, and just say, Mum, is that a comfortable height? So you'll have to learn how to use the remote, which will be under the head of the bed. Just take it up slowly, and then just say to your mother, now Mum, just tell me when you'd like the head of the bed to stop. And she can nod her head if she likes it, if she doesn't like it. And then you get just the right position. And then you know for future times as well what she's likely to appreciate or feel comfortable with at that angle. Now, For the head, get the feather pillow, put it around behind your mother's head, and then curve it a bit around the neck. So you sort of take the feathers out a bit, so there's a little hollow, and then she's got her head into the pillow, and then all the feathers or the foam chip is sort of supported around. It's a lovely position, because then you can just put your head back and you've got that support either side, rather than rolling around on a firm rubber pillow. Terrible. Okay, arms. Okay, so sometimes the arms can get really uncomfortable to the sides when a person's in bed. So you just smooth out the feather pillow, you make a little trough for the arm. So scuff it out a bit, scoop it out, make a little trough for the arm, put it under long ways under your mother's arm with her arm relaxed in the centre of it. Beautiful position. The other side, a little trough, and make sure it's not too bulked up at the top, and then they can just relax their arms down and comfortably. You know, it's a beautiful position. So that's 3 pillows. 4th pillow under the knees. It's often a very good idea to put a pillow under the knees to prevent the person from sliding down the bed. Now, it may take quite a bit of experimenting, trial and error, to get this little equation sorted out. But once you know what the person finds comfortable, then you know for next time, more or less, you can arrange them in that position, and it's so fabulous. If the pillows get a bit much for when staff are around, just put them at the top of the wardrobe, but hopefully the staff will come around and put these pillows in this position as well, especially if you ask them and say, look, mum finds it really comfortable if the positions of the pillows are put in this way. You know, if the pillows are positions like this, show the carer what the position is and ask her, would you mind with mum positioning her like this, and then I'll rearrange when I come. Very good. So I've written about all these topics in the books, The Resident's Voice and The Resident's Rise. Thank you for your viewing and likes. Please subscribe. Thanks a lot.